industrial accidents, ancient
solving
poisoners,
crime,
poison
chemical
prevention.
spills. This is Toxic History.
Dr. Natalie McConnell is the academic chief resident at Mount Sinai Hospital. Over the past 3 years, she has developed a special interest in substance use and forensic toxicology. Thank you, Dr. McConnell.
Today, I will be telling the tale of Dr. William Palmer. He was also known as the Prince of Poisoners, the Rugley Poisoner, and the greatest villain that ever stood the Old Bailey Dock. And for those that don't know, the Old Bailey Dock is the central courts in England, in London. So who was Dr. William Palmer? Well, he was a convicted murderer and allegedly a serial killer. But before we get into that, let's explore his life before he started killing people. He was born on August 6, 1824 in Rugley, England. He was the fifth of 7 children, and he was born to a successful businessman and timber merchant. His family was decently well off, and as a kid, he was known to be a troublemaker. He was described as always being up to tricks, and he conned his father's employees into giving him their spare change. At the age of 17, he left school and moved to Liverpool to find a trade. There, he worked as a wholesale chemist, but was fired from his job after he was caught embezzling money. He was able to avoid imprisonment with the help of his mother, but ultimately left Liverpool and ended up back in Rugley. Though his time in Liverpool was short-lived, it was enough time for him to develop a gambling problem. Specifically, he loved to bet at the races. This will become important later. Upon his return to Rugley, his mom helped him get a job as an apprentice to a surgeon named Edward Tylecott. Palmer was obviously not the best employee, and Tylecott ultimately fired Palmer after some money suspiciously went missing. There's a bit of a theme here. His mom bailed him out once again. This time, she was able to get him a position as a walking pupil at a hospital, basically a student who would follow doctors around as they did their rounds. A year later, Palmer moved to London to further his education. He promised to pay Dr. Stegall, a well-known surgeon at the time, to tutor him and help him pass his exams. In 1846, William Palmer passed his exams and became a member of the Royal College of Surgeons. He never did pay Dr. Stegall, and rumor has it that Palmer passed his exams because he paid someone to impersonate him, though this was never proven, and also not that likely, as Dr. Palmer was not known for paying anyone for anything. While studying to become a surgeon, Palmer drank, partied, and of course gambled. After he received his diploma, William Palmer decided it was time to quit his bad habits, return to his quiet life at Rugley, and get married. Of course, he was looking for a wife with a fortune. Soon after his return to Rugley, he meets Annie Brooks, the illegitimate child of Colonel Brooks, and a housemaid named Anne Thornton. Colonel Brooks owned various homes in Rugley, and after he committed suicide, supposedly due to the harassment he endured from Miss Thornton, he bequeathed all his homes to Miss Thornton. And as for Annie, she inherited his wealth. She was the perfect match for Dr. Palmer. They wed on 1847, and during the first year of marriage, Palmer seemed to have turned his life around. They had their first child, William, in 1849. But soon after his birth, Palmer ended up quitting his job. In reality, no one would hire him as a surgeon, so he made a career shift. He bought racehorses and began gambling again. Between 1849 and 1854, multiple people in Dr. Palmer's life suspiciously passed away. After their son William, Annie and Dr. Palmer had 4 more children, all of whom died in infancy due to convulsions. Dr. Palmer also had an illegitimate child with a woman named Jane Mumford. This child also died unexpectedly soon after her first visit with Palmer. Palmer was in a lot of debt due to his gambling. He frequently would ask his mother-in-law, Miss Thornton, for money. One day, she refused, but immediately changed her mind when she saw how angry Palmer had gotten. She feared something would happen to Annie if she did not loan him the money. She sent him 20 pounds. He was displeased with this amount, but remained cordial. A few weeks later, he asked Miss Thornton to move in with him and Annie. Miss Thornton initially declined, but he was very persistent. She moved in with Annie and Palmer and within 2 weeks died of unknown causes. After her passing, Palmer inherited all of the homes Miss Thornton had inherited from her late husband. Several years later, Dr. Palmer's wife, Annie, died. Before her death, Dr. Palmer took out a 13-pound life insurance policy. That same year, Dr. Palmer's brother died unexpectedly, and it turns out he also took out a life insurance policy on his brother several months prior to his death. Dr. Palmer was desperate for money, and of course, the insurance companies at this point were very suspicious of Palmer and hired a private detective to investigate him. Though Palmer was suspected to have murdered his children, his wife, his mother-in-law, and his brother, it was the murder of John Parsons Cook that made Dr. Palmer a notorious poisoner. John P. Cook was Dr. Palmer's friend and fellow gambler. Mr. Cook won a large sum of money in a race one evening in November of 1855. Later that evening, Dr. Palmer and John Cook were celebrating at a bar called the Raven. While drinking brandy, John Cook noticed a distinct burning sensation after he finished his shot. He then became violently ill, and a medical man was called to his bedside and recommended force vomiting to remove the possible poison from his stomach. John Cook vomited repeatedly for hours after the incident, but he did survive. Cook suspected Palmer had poisoned him, but forgave him nonetheless. They went out to dinner several days later, and the next morning when Cook woke up, he once again felt ill. Over the course of the next couple of days, Dr. Palmer provided Cook with a broth that caused him to vomit excessively. Finally, the night before Mr. Cook died, Dr. Palmer gave him 2 pills. These pills caused him to scream wildly as he grimaced, arched his back, and convulsed or had full body shaking. He ultimately died. However, prior to Cook's death, Palmer collected all of his winnings. Palmer was present for Cook's autopsy. At the time, people believed Palmer was Cook's doctor, so that may have been the reason why he was present, though it's not totally clear. But during the autopsy, Cook's stomach and intestines were removed from his body and placed into a jar. Palmer attempted to tamper with the jar, but he was unsuccessful. The jar was sent to Dr. Alfred Taylor, also known as the father of English toxicology and author of A Treatise on Poison in Relation to Medical Jurisprudence, Physiology, and the Practice of Physics. Dr. Taylor served as the star witness in this case, and he reported that there were no traces of tetanus found in Cook's stomach or intestines. He then testified that only strychnine or tetanus could cause the spasms experienced by Cook, but that strychnine was very difficult to test for. During the investigation into Dr. Palmer, it was discovered that he had purchased strychnine in the days leading up to Cook's death, and so Palmer was convicted of murder. Now, just to go over, strychnine is an alkaloid found in the seeds of a plant native to Southeast Asia. It has been used as a rodenticide in the past, but it's also been used medically, though I'm not really sure how or why, for anaphylaxis, hyperglycemia, sleep apnea, and snake bites. It is a postsynaptic glycine receptor antagonist, so basically the neurons that cause muscle contraction, it helps to stop that. If glycine is unable to bind to the receptor, you get these involuntary generalized muscle contractions with a predominance of the flexion of the upper extremity and extension of the lower extremity, resulting in this arched back positioning or opisthotonus that Cook was noted to have. It also causes extreme muscle spasms of the face, resulting in a locked jaw as well as a grimacing facial feature. Dr. Palmer, after he was convicted, was sentenced to death by hanging. Though he was only ever convicted of murdering John Cook, many believe that he was a serial killer responsible for the death of his children, his mother-in-law, his brother, and his wife. And if you recall, I mentioned that his children died of convulsions. So it's very possible that he also used strychnine to murder them, allegedly. Thank you for allowing me to tell this tale.